Hello, and thank you for joining the Pharmacy Quality Alliance Academic Member Engagement webinar. My name is Chris Kochevar, and I am the Executive Fellow for Pharmacy Quality Alliance, and I'll be leading the webinar today. To give you an idea of what we'll be discussing today, we'll start off with talking about who PQA is, for those of you who may be unfamiliar with us. We'll then get into different ways that you can be involved as an academic member, with our Healthcare Quality Innovation Challenge, which is an annual team-based student competition. We also are offering an academic lecture that's presented by PQA this year. Following that, we'll talk about our Medication Use Quality Certificate, which recently launched in June as a continuing education program. And finally, we'll talk about experiential learning opportunities, including our APPEs, our internship opportunities, as well as the Executive Fellowship. We'll finish out today with any questions that you may have. So jumping right in here with who Pharmacy Quality Alliance is. For a little historical context, Pharmacy Quality Alliance was formed back in 2006 as a public-private partnership. Now, the significance of 2006 for healthcare in general was this was the year that Medicare Part D went into effect. And of course, this is the medication side of Medicare. And when Medicare Part D went into effect, overnight, the federal government became the largest payer for prescription medications in the entire country. And the government realized at this time that they only wanted to be paying for the quality use of the medications that they were helping pay for. So this being said, they formed a public-private partnership, and PQA was formed because of this, to help fuel this quality medication use for Medicare. Since then, PQA has evolved to become a nonprofit quality measure organization. And I'll get to in a moment what that really looks like and what that means with the different things that PQA is involved with. However, three things have remained true over the past 15 years. We have had a multi-stakeholder membership over that time period, and I'll get to in a moment what that looks like. We've been transparent in the process that we have, especially when it comes to our measure development, engaging our members all through that process. And finally, we're consensus-based in what we do, really looking to our members to be the voting members in order to endorse the measures that we come up with. So what does our multi-stakeholder membership look like? Well, I'll start off here by giving some context that you don't join PQA as an individual member, rather you join as an organization. So if you're tuning in today as an academic member, your academic institution has joined PQA as a member, and you therefore, because of that, are also a member of PQA as an individual and have access to all of our resources. Now, in addition to academic institutions, you can see here we have a number of other members, whether that be community pharmacies, including organizations such as CVS, Walgreens, Rite Aid, but also a number of smaller, more local chains and some independents. In addition to that, we also have health plans and health systems, health information and health technology companies as well. In addition to that, we also look at the life sciences, being our pharmaceutical companies, government agencies, as well as other pharmacy associations and research institutions. So you can really see here that we do really cross the board of pharmacy when it comes to the organizations that are members of PQA. So as mentioned earlier, PQA has evolved from being just a measure developer to taking on a number of different roles within our quality organization. We continue to do measure development, as you can see here, but we also work with quality education, working both with our academic members within that, but also with across our membership base and with the general public, looking at different workshops that we do, webinars, different member education pieces, and beyond. In addition to that, we're also involved with research, partnering with a number of organizations to do healthcare quality research and really help to fuel both our quality measure development, but beyond that as well. And finally, looking at our convener role and really looking to bring together that multi-stakeholder membership that we saw previously to try and discuss and solve today's issues facing healthcare quality. So with that in mind and the general overview of PQA, I want to dive in now to the Healthcare Quality Innovation Challenge, or HQIC, which is a competition each year that's open to all students at any school or college of pharmacy. To give us an overview of this competition, HQIC is an annual team-based student competition that's hosted both by PQA as well as Pharmacy Quality Solutions. And Pharmacy Quality Solutions, for those of you who are unfamiliar with them, they are a leading provider of performance management services representing 90% of Medicare Advantage payers and 95% of community pharmacies. So I mentioned that this is a team-based competition, and so the general overview of this program is that teams choose one of 3 prompts, which we'll discuss briefly in a moment, that they then put together a business summary proposal for to submit. These proposals are judged by a panel of PQA members, and the top 3 teams then pitch their proposal at the PQA annual meeting. I will mention that these top 3 teams, there are cash prizes associated with each of those top 3 as well, so that is another incentive certainly for students to be participating within this. Jumping into our timeline here, and what we really look at with our timeline, August is when the prompts are released, and so these are on our website now within a general overview document within the education tab and student programming tab of the PQA website, so those can be viewed there. Students then work throughout the fall semester to put together this business summary proposal. And I had a webinar last week regarding what that business summary proposal contained, as well as a general overview for HQIC for students to view, which has now been posted across our social media. And so I encourage you to tune in there to be able to view that presentation as well. So January 15th is when the applications are due, including that business summary proposal. From January 15th, we then look to judge the proposals on our end. And so we put together a panel of judges from across our multi-stakeholder membership, and over that 6-week time frame, those different proposals are judged. On March 1st then, we look to announce those finalists. For those top 3 finalists, we then ask that they send in their presentations by April 15th for review so that we are prepped for the May annual meeting when the live competition takes place. So who makes up the teams? Well, first and foremost, I do want to mention that project advisor is one of the roles within the team here as well. And as a faculty tuning in at a member institution, we really hope that you would consider being a project advisor if approached by a team as well, or help refer students to other faculty that you know that are interested in being a project advisor for this type of activity. So project advisors must be faculty at a school or college of pharmacy, or a pharmacist at a PQA member organization. In addition to that, of course, then there's the students that are on the team. And so we have 2 to 4 students per team, and at least one of those students must be a pharmacy student. Now, beyond that, the others that are on the team can be from a wide variety of disciplines. You can have other pharmacy students. Certainly, you can have 4 total pharmacy students on the team. You can have other healthcare professional students, such as medical or nursing or otherwise for those students as well. And finally, you can also have business, engineering, computer science, or other disciplines of students as well that may be beneficial to have on the team. So having a multidisciplinary team, seeing as this involves both healthcare, but also the business side of things and technology-driven solutions, can really prove helpful for these student teams as well. Looking at when the application is due, of course, is on January 15th. And within that application, there's a number of different things. The first several bullet points here, just being more general information from the project title, the prompt that was selected, the college or university name, as well as the contact information of the team and the advisor. But in addition to that, then there's 2 PDFs that are uploaded as well within this application. The first is simply being a letter from the college or university, so the College of Pharmacy or the School of Pharmacy, essentially, just giving approval for the team to participate and saying that if selected for the annual meeting, that the school will help support them in order to attend that meeting. I will mention that we do ask that at least 2 of the students per team are participating in the annual meeting if selected as a finalist. And finally, we look at the PDF upload of the business summary proposal. Again, I went into more details within that webinar last week, and it's also included in our overview document on our website as well, so what that contains. This isn't a full business proposal that we think of that's perhaps 40 to 50 pages long or longer, but instead of that, we look for about a 12-page or less document that really is kind of that summary proposal rather than every single detail being spelled out. So again, look to our website for those documents that just better describe what the business summary proposal is. So here we're looking at the prompts for this year's HQIC competition. The first having to do with pandemics in pharmacies, and as you may imagine, certainly a pertinent topic when it comes to today's day and age, but recognizing that this may not be the only pandemic situation that students may face either on the larger scale or on a more local scale potentially as well, looking to develop a technology-driven solution for contactless pharmacy operations is what this prompt regards. In addition to that, looking at mental health in patients, and again, recognizing that pharmacists are accessible healthcare providers that can help link patients with other resources in their community. So looking at developing a technology-driven solution to connect patients with mental health resources after assessing that patient's risk for mental health illness as well. Finally, looking at bridging gaps in healthcare and recognizing that pharmacists can help improve health equity within their communities that they serve as well. And so looking at technology-driven solutions that identify and address patients' health disparities based on the social determinants of health or low social and economic status as well. So we hope that students will find these prompts to be pertinent and beneficial to their learning as they look to develop a solution based on one of these 3 prompts. So that wraps up our HQIC overview for the competition here. Again, refer to our website under the Education and Student Programs tab for more information on HQIC, and always feel free to reach out. Our contact information is included towards the end of this webinar as well. Transitioning now into our academic lecture. This is a member-exclusive engagement opportunity for you. It's a lecture that's presented by PQA and by myself, actually, as the Executive Fellow to students at schools and colleges of pharmacy. So looking at what the opportunity for this lecture really includes would be that it's a lecture that we offer to each member university in a course of your choosing. And so whether that's a pharmacy practice course, if you have a quality elective, you can select one of the courses within your curriculum that we're willing to either access the live version of this, where I can present this live, or the recorded version as well. The recorded lecture is about 35 minutes, and the live version would be about the same. And I'll get to in a moment what we do for an active learning component in addition to that 35-minute time block. So with the recorded version, certainly, again, reach out to us at our contact information included later if you'd like access to that. I can send directions on how to access that and how to get your students access that as well. That live version, again, would be reaching out to us with the contact information included later and asking just regarding the date and time that potentially you're looking at for having that included, just to make sure that we are able to accommodate that on our end as well. And so certainly, you know, we do have other things that may be conflicting with that. And so depending on how flexible you can be within the class schedule, that can be a conversation that we can have further if you were to reach out. Looking at the learning objectives here as well that I have listed, just to give you a broad overview of what the lecture does include. We really look at healthcare quality from a 30,000-foot view to start, and then really start to zoom in more on the pharmacy side of things. And so describing measures themselves, but also describing how they relate to healthcare in general and the importance of measures, especially in relation to value-based care. We also do discuss the 4 roles that the PQA currently has in healthcare quality, diving in deeper to 2 of those 4 roles as well within the presentation. As mentioned, in addition to the lecture, there's an active learning component that can be incorporated. So if you were to use the recorded lecture, this can certainly be used in a flipped classroom type format or as a supplemental activity viewed outside the classroom as well. With the live lecture, I also include an active learning activity, and in addition to that lecture itself, looking at a Let's Make a Measure group activity where we have the students work in groups to work through the different components that are included within a measure to help make essentially their own measure out of that activity as well. So we hope that it helps engage the students and really drive home how measures are thought of and how they're created, as well as how they can be utilized within the patient care settings to drive quality improvement projects and better patient care. So that concludes our academic lecture portion of the presentation. Again, reach out at the contact information included later in this presentation for more information both on the recorded and live lecture. So switching gears now into our Medication Use Quality Certificate program. This is a 15-credit-hour continuing education program that is accredited for 4 different disciplines, and I'll get into that in just a moment as well. But in addition to that, we do see this as useful to students, in addition to faculty member pharmacists and others as well. So looking at the overview of the Medication Use Quality Certificate, as mentioned, it's applicable to both faculty and students. There's 14 hours of online self-paced content that starts the program. And then there's a final 1-hour live session that's conducted virtually. This is currently offered consistently twice each month. And then we also offer additional sessions for organizations that have a larger number of individuals that are participating in the program as well. So if there's a group of students or a group of faculty or a mix of both faculty and students that would like to have a live session specifically for your academic institution, certainly is something that we can look to set up as schedules allow for everyone involved within that. This program is accredited for pharmacists as well as for pharmacy technicians, physicians, and nurses, and so we really do view this as interdisciplinary as well. Looking at what the program covers, again, touching on value-based care and how healthcare quality in general comes into value-based care. In addition to that, looking at innovative pharmacist-provided initiatives as well and how quality relates to those, looking at social determinants of health and health information technology as they relate to healthcare quality, looking at specific programs, including Medicare and Medicaid, finally looking at private sector innovation, but also a number of different disease states that are high impact areas of care that have quality metrics associated with them as well. So really try and provide a broad coverage of different topic areas here to give an overview of healthcare quality as it relates specifically to medication use. As far as how this appeals to academia, it certainly could help fulfill some APPE competencies potentially. Looking at interprofessional education opportunities here, if there are students from across different disciplines that are taking this together and then perhaps participate in that live session together can certainly be a good interprofessional education opportunity. Looking at the entrepreneurship opportunities as well with this, and again, from that innovative side of things and helping fulfill, that entrepreneurship side of learning for the student. And finally, looking at a potential co-curricular offering here as well is that if this is offered as something that a student can pursue outside the classroom to help fulfill an additional kind of supplement to what they're learning in the classroom, can certainly be contributed to a curriculum in that regard. So we do really view this as allowing students to help set themselves apart, both in learning about healthcare quality, but also about having that certificate associated with them as well that they can take with them and carry throughout their career. As far as access to the certificate goes, we do try and provide a steep member discount for our academic members, looking at $150 per certificate, which is a discount that's far greater than our standard member discount even is. And that's really in recognition of your role in training the next generation of healthcare quality professionals. In addition to that, students as well can access the certificate. It's $99 per certificate for a student. We do have bulk pricing options that are also available if you purchase for an entire class. So if, for instance, the entire P2 class would benefit from participating in this program, then certainly that would be an option as well, and reach out to us for more information on the bulk purchasing options. So that wraps up our medication use quality certificate. Again, for more information, we do have an info page on our website with kind of more of the specifics as to what's included within this. But beyond that, also considering, again, just reaching out to us for access to that academic member pricing and student pricing. And finally here, I did want to touch briefly on our experiential learning opportunities that we do have for students beyond just the engagement opportunities at the academic institutions themselves. So talking first about internships and APPE experiences. So we do offer an internship in association management. This is typically for first through third year student pharmacists. It's an 8 to 12 week summer internship in associations management that we, again, conduct during the summer months. Without COVID, typically we do have this as an on-site opportunity as well, so keeping that in mind. Applications open in September and do close December 1st, and so certainly is something that throughout the fall semester students are looking to apply for this internship. I know it's oftentimes earlier than some internship application cycles, and so keeping that in mind for students as well. As far as APPE experiences go, these are 4 to 8 week experiences, just depending on the school requirements for their APPEs. These are for final year student pharmacists as well. As you may imagine from the APPE side of things, applications are open in September and close December 1st. These experiences really allow our students to come in and learn more about PQA, about healthcare quality in general, about measurement science, and really kind of a lot of things in between with that as well. And so there's a number of different meaningful projects that we have the students work with in order to contribute both to their learning, most importantly, but in addition to that, also be contributing to PQA as an organization while they're here. And finally, talking about the Executive Fellowship as a postgraduate opportunity. So this is an Executive Fellowship in Associations Management, and it's a one-year fellowship from July 1st through June 30th of each year. There is an association management focus with various opportunities for research experience, as you may imagine, with us being involved in research, but also for quality measurement experience and quality measure science experience as well. And so it really gives a wide variety of experiences to help the professional really grow in the healthcare quality realm and really understand healthcare quality in general as they pursue deeper into their career. Applications for this are due mid-December as well, and then interviews are conducted then in January. And so keeping that in mind, again, for students with as they look at postgraduate opportunities, that our application cycle typically concludes about mid-December and then moves into the interviews phase. So that wraps up our experiential learning side of things. If you have students that are interested in the experiential learning opportunities that PQA has to offer, you'd like more information beyond what is offered on the website, again, reaching out to myself, I'm always happy to talk with students more via email or setting up a brief phone call to discuss these opportunities further. So we've gone over quite a bit of ground today, and so I do want to give a summary of just the key areas for involvement for our academic members here at PQA. So a number of different ways to engage. First with HQIC and encouraging participation from students, but also consider advising a team if it arises that students are looking for a team advisor. Looking at the quality lecture that's offered by myself as the executive fellow and looking to incorporate that into a course, either in the recorded or in the live format. Then looking at the medication use quality certificate, looking at participating as a faculty member, potentially encouraging your students to participate, especially either taking it, perhaps at the same time as them or after you take it, and being able to speak to students about how they may find meaning in that as well. And then finally considering, potentially bulk purchasing for an entire class of students. That's something that interests your institution as well. And finally, looking at the both experiential learning, both within school as well as beyond school, and encouraging applications for those internships, APPEs, or fellowship opportunity as well. So wrapping up our presentation here today, I do thank you for joining us and tuning in. And I do want to encourage you again, if you have any questions, if you're wondering about more information for any of the engagement opportunities that were discussed today, academics@pqaalliance.org would be the email to reach us at regarding any of these opportunities. We look forward to engaging with you throughout the fall semester, and we hope to visit with you soon in another webinar joining you next spring. Thank you and have a good rest of your day.